Jaundice. Introduction. Jaundice is caused by too little bilirubin in the body. Select true or false. Correct. Jaundice is caused by too much bilirubin in the body. Yellow skin is always caused by jaundice. Select true or false. Correct. Sometimes a person may have pseudojaundice. This is caused by a person eating too much beta-carotene. It is not jaundice and doesn't have anything to do with bilirubin. Which one of the following can cause jaundice? Choose one of the following options. 1. Gallstones. 2. Viral hepatitis. 3. Both 1 and 2. Correct. Jaundice is a symptom of a disease rather than a disease itself. A number of different conditions can cause jaundice, and jaundice will only go away if the condition is treated first. To diagnose the underlying cause of jaundice, most tests are used to examine the blood, liver, gallbladder, and bile ducts. Select true or false. Correct. Common causes of jaundice are related to the blood, liver, gallbladder, and bile ducts. The treatment of jaundice depends on the underlying cause. Select true or false. Correct. Treating the underlying condition is the first step in treating jaundice. Thank you for using Explain.